We're going live. Hi, everyone. Thanks for joining us. We are going to wait for people to filter in and we'll get started in 2 minutes. All right, thank you everybody for joining us. Let's go ahead and get started in the interest of time. So thank you for joining us for session 3B of our Racism and Mental Health Symposium, the impact of the US criminal justice system on the mental health of Black Americans. Our session today will be ending at 4:30, but please be advised you should join the closing remarks session after this. We are going to be explaining the CEU certification process during that session, so you don't want to miss it. But a few housekeeping things. Same as for the rest of the symposium, viewers are in view-only mode, meaning that you will not be able to share your audio, your video, or your screen. If you want to communicate with us today, please use the Q&A feature if you have questions. We will be getting to the questions at the end of the session, so keep that in mind. Please use the chat box if you have any comments, if you want to share resources or discuss with other attendees. You must attend the full session through Zoom to receive CEU credit. This is the same as for previous sessions. Just make sure that you can see the presenter's slide and our video today. Our session is being recorded and it will be posted to our website, and that is the same for all breakout sessions. So if you want to share what you learned today with others, we'll be posting them 1 to 2 weeks after the symposium is completed. Or if there was a session that you missed and you want to go back and watch some of the other sessions, you'll be able to do that as well. The last thing to keep in mind is that the subject matter of today's symposium may be a bit sensitive for some people. You should step away if you need to. You can also reach out to the room monitors using the all panelist chat function if you want to speak with somebody about what you're experiencing. So with that, I am so excited to introduce Dr. McLeod. Dr. Crystal McLeod is a licensed clinical social worker who also serves in the United States Air Force. She has a depth of clinical experience that focuses on trauma, depression, anxiety, self-care, and positive image in women and girls. She also works in the areas of substance use and family violence. Dr. McLeod recently completed her last 2 years of doctoral studies working on decreasing recidivism rates among first-time drug offenders and showing the impact that the prison system has on the well-being of Black males, their families, and communities. So thank you so much for being here, and I will hand it over to you.
Thank you so much. Thank you so much. All right. Let me get on here. All right, so thank you so much. I really appreciate the introduction, and welcome everyone. My name is Dr. Crystal McLeod. I am a mental health therapist, and today I'm gonna talk a lot about the mental health of Black Americans and how the criminal justice system impacts that mental health as well. So as far as questions, we'll handle all questions at the end. Just make sure you drop them in that Q&A and I'll be able to answer as many as I can at the end. All right, so some of the things that we're going to talk about today is relevant statistical data, because obviously when we are making recommendations and talking about things, we want to make sure that we have great data to be able to talk about those things. who does recidivism impact, right? We're going to talk about recidivism and who that impacts primarily. Some of the theories that I feel are associated with Black mental health in the criminal justice system. We're going to talk about implicit biases. We talked a lot about that this morning with Dr. Joy, and kind of how implicit biases impact how we experience social justice as a culture as well. Again, the impacts on Black Americans, rehabilitation versus incarceration, some of the advantages and disadvantages of that, and what needs to change in order for us to do better within this area. So you may see me do a little bit of this back and forth with my eyes because I have several screens set up here. So I just want to make sure I'm able to let you know kind of what I'm doing here. All right, so let's check out this first slide, some relevant data here. This figure was taken from the most recent data from the Bureau of Justice, and it shows that the statistical data for people who are currently under supervision. And what I mean when I say supervision, I mean in prison, probation, or on parole. So while this data shows a decrease in prison rates from 17% from 2008 to 2018, what it does not show you all is the recidivism rates amongst first-time drug offenders or even prisoners are still at over 80%. So that means 80% of people are still returning to prison after they're released from prison, though within 19 years, we're showing a less than 20% prison rate of people actually serving time. So what this says to me is that, yes, we have less people in prison, but we actually have more people returning to prison. And that's kind of what we're going to talk a little bit as we go forward, is why are people returning to prison at higher rates than people that are currently in prison? So if you look at some of the graphs here that I pulled, and if you want to check out any more in-depth information, there's a website there below that you can actually go into and check out. But Black males ages 18 to 19 were 13 times more than their white male peers to be incarcerated, which is one of the highest racial disparity groups amongst any age group. Along with that as well, we also have females. Black women ages 18 and 19 are also incarcerated at much higher rates than their white or Hispanic peers as well. So if you look at these figures here, you'll see that almost half of the prisoners sentenced were serving time for drug offenses. And we're going to break that down a little bit more as we move to the next slide here. All right, so this was a big part of my work here on recidivism rates, obviously. How do we decrease recidivism rates amongst first-time drug offenders? So basically the BJS, and when you hear me say BJS, I'm going to be talking about the Bureau of Justice System. This is where all of my data come from because it's a lot of real-time data. And if you click on that website, you'll see data that is most present within the month, okay? But one of the areas that they struggle with significantly is really measuring what recidivism looks like. So this data was just released in 2018 based on a study from 2005 to 2014. And this is talking about recidivism rates. So without a concrete definition of what recidivism is, it is really hard to engage how we're measuring recidivism. So that's one of the problems when I look at recidivism data. What does that even mean? Does that mean someone violated parole? Does that mean someone tested positive when they were checking with their PO? Does that mean somebody had a reoffense and had to return to jail? So there are so many things that we can look at when we think about recidivism. And I'll talk about that being one of the barriers to really getting some good data in this area as well. So the study that I decided to use for this was a 9-year study, like I said, that ended in 2014. After 2 years of compiling this data, what was learned in this study is that upon release from prison, 5 of 6 prisoners, that is 83%, were rearrested at some point during this study. If you take a look at to my left here, you will see that figure 1 that shows all 9 years. What you see here is the first year of someone being released from prison is the highest year that they will actually return back to prison. And we're gonna talk about that as well as we kind of move on. Of those 83%, 77% were released were for drug offenses. Right? So right now, what we know so far is that Black males are dominating the prison system and that the prison system is overwhelmed by those who have drug offenses. So which is about 46%. And we'll talk about that on the next slide as well. All right. So some data regarding mental health and race, which is actually why we're here today. If you take a look here on the left, you'll see here that when we look at drug abuse and drug dependence, or both, what we're actually seeing is that 68% of people are currently in local prison systems for drug abuse dependence, are both 45% in federal prison, which is actually rounded about almost 46% if you go decimal points forth, and 53% in state prisons. So what we're actually seeing here is that a lot of people are currently in prison for drug use, drug dependence, or drug abuse as a whole, right? So if we have 83% of people returning to prison, but over half of those people are in prison for drug use or drug distribution or dependence or whatever it may be, what we're realizing is that rehabilitation is actually probably not happening in prisons. So in 2014, check out this table right here to the right, Gonzalez and Gunnell completed a study attempting to identify barriers to mental health treatment in prison. So during their study, it was learned that correctional facilities are often considered to be the largest mental health facility for services. Now, why would correctional facilities be the largest mental health institution to help people who need support for alcohol, drugs, or other mental health issues? But what we do know is that rehabilitation is not actually happening in prison because we have a 83% recidivism rate for people coming out of prison with drug and alcohol problems. So what was also learned is that 26% of inmates were diagnosed with a mental health condition, and more than 50% of those individuals who were on medication before prison was not provided with medication while they were actually in prison. We also learned during this study that former inmates who received formal mental health diagnoses are 70% likely to return to prison at least once versus somebody who's actually not given a mental health diagnosis. And when we kind of get into the actual mental health stuff, we're going to talk about that as well. But I want to definitely put these statistics in your mind so you can kind of see what's happening right now with Black men in the prison system. So when we look at that 77% recidivism rate of drug offenders, it continues to increase the knowledge that, hey, rehabilitation is not happening in prisons. And you're going to hear me say that quite a bit throughout this presentation. So though courts mandate access to mental health care in prison, this requirement tends to get met only if the mental health condition is severe or serious enough to cause a safety issue within the prison system. So what that means is you'll see individuals with diagnoses like schizophrenia, psychosis, those mental health conditions are actually being treated in the prison systems, not necessarily with therapy, but with medication. So those people are likely to receive more medication as a result, versus other people in prison with diagnoses that may be anxiety, depression, adjustment disorders, and those different types of things like that. So this group, you see that arrow poking there, this group here found that Black inmates were more likely than their white peers to receive more medication and continuous medication treatment for schizophrenia or for psychosis disorder than any other population. So what this is basically saying is that Black males have higher rates of symptom severity in a general population, so therefore they may need more medication continuity. Now, the study said that, but I'm going to tell you what I believe a lot of these issues are coming, how these issues are coming forth as well. So let's take a look again at table number 2. It shows that, for one, females that they make up only 9% of the prison system, but are more likely to be diagnosed with a mental health issue than any male of any race. But look at where Black males rank slightly below their white peers for current and past mental health issues. But keep in mind that Black males continue to be medicated more frequently for severe mental health issues while in prison more than any other population. So what do we know about Black men? What do we know about the perception of Black men? What do we know about biases when it comes to Black men? Is that they're feared. And remember, if Black males are dominating the prison system and they're already feared, there are a lot of explicit biases that may be triggering a lot of biases that people working in the prison system have regarding Black males. So in order to control Black bodies, specifically Black male bodies in prison systems, we're going to medicate Black males at a higher rate than we would anybody else in the prison system. Now, is there any statistical data that's showing that that may be the answer? No. But when you think about implicit and explicit biases and how Black people are treated in our criminal justice system, the same people who provided supervision, the same people who are actually COs in the prison system, seeing male bodies dominating the system, that fear naturally wants to keep that person under control. And that's what medication does. It keeps people in control or in a more calmer state. All right, so let's look at some of the impacts here. Here are some of the impacts we see on Black families and communities and Black mental health when we think about the prison system. So I'm going to talk a little bit about while they're in prison and after prison, and kind of see this big impact this incarceration system is causing. So 27% of previously incarcerated individuals are unemployed. This number is actually higher than the Great Depression. The Black unemployment rate is 7.4% versus whites at 3.7%. Now, this is 2018 data, and you'll have all my resources at the end here. Now, why would Black unemployment rates be a lot higher than their white peers? Well, whites tend to have a stronger social tie after being released from prison. So it's a lot easier for them to make connections. Somebody in the family may know somebody to give them a job. Depending on the socioeconomic status, they may have a family business. And let's just be real, they also face less discrimination when coming out of prison. So therefore, they are going to be given more opportunities for employment, even if their criminal records are actually, even if they have a criminal record just as a Black male would be. So also, let's look at the income of individuals who enter the prison system. Statistically, individuals who enter the prison system are more overwhelmingly poor than anyone. So 2/3 of people detained in jails report annual incomes of under $12,000 before their arrest. So we're in 2020, right? Imagine, taking care of your family or yourself, or even, prior to whatever, living on $12,000 a month in 2020 and what that looks like. That can be very overwhelming, right? So incarceration has contributed and continued to contribute to poverty due to criminal debts and fines that individuals have to pay, difficulty assessing public benefits. So if you have a criminal record, you may not be able to get any type of public assistance. Actually, you're not. Currently, there are over 400,000, and yes, I said 1,000, civic limitations for those that have a felony criminal record. So if you need a house or you need to get put on housing or try to get housing, this record is going to prevent you from actually being able to get any type of housing. So what this continues to do in the unemployment and the employment and financial realm for Black families, it continues to weaken Black families' financial wealth, because it is hard for Black families to recover when their loved one comes home from prison, because there's so many limitations that is placed on their financial well-being and their financial wealth during that time. So let's check a look at some of the family and community impacts. Policing, right, which causes collateral damage to Black communities. So we've heard it, hey, I don't want to live around a bunch of Black people. We don't want Black people in our communities because that brings the value down of our communities. When we constantly have high levels of removal, and what I mean when I say high levels of removal, I want you to think back to that recidivism rate issue we talked about. If we constantly having people removed in and out of our community, what it does is continues to put Black people's communities at a lower social and economic advantage. People do not want to invest in our communities. It prevents businesses from starting in our communities because people are afraid to invest their time and energy in communities that they don't feel can sustain over time. So high policing continues to cause that to be a problem. If police are running through the neighborhood every day and all day long, people are turned off from that. People that may want to come into communities where Black people are. So high policing is definitely having a problem in our communities as well. Children of incarcerated individuals show poor school performance and behavioral problems. So let's talk about that school to prison pipeline, right? We see a lot of our children get caught in this pipeline. And statistically, if one parent experiences incarceration, it shows that your child is at a higher chance of going to prison as well. What can cause school performance to be bad? Well, you have a parent that's missing from the household. You have a single parent that has to work to take care of these children. And so a lot of times the attention needed in the household may not be able to be there because you're simply trying to survive to feed your children and put food in their mouth. So a lot of times these children may act out at school or may be upset because their parent is gone as well. So you definitely see poor school performances, obviously because they're continually being kicked out of school because of these behavior problems, and nobody's really looking at why these behavior problems there. It's just as we heard some of the speakers spoke earlier, our children are already target once they hit school. So this causes more of a problem as well. Women whose partners are in prison suffer higher rates of depression, right? Because, if you have a mother with 3 kids, the biggest thing is I got to take care of my kids. I don't have time to take care of my mental health because I have to take care of my kids. So my depressive symptoms can really become very, very significant, but I just don't have time to be bothered with that as well. So I already talked about the communities and high levels of removal. So let's talk about the mental health component, right? The impact that incarceration and returning to after incarceration has on mental health. Something called empathetic incurement. So when we think about empathetic incurement, think about somebody having lack of empathy towards your situation. Commonly what we see amongst people who are returning home to their families is they really don't grasp the impact that their absence had on their family. It is really, really difficult for them to grasp that impact. And so what tends to happen is there continues to be some conflict when they come home. It's like, you don't understand. We've been doing things this way. This has been going on this way with our children, money, different types of things. And it's like that individual is not able to be empathetic. So the likelihood that they're going to be able to reintegrate successfully into their family is low, which means that that's going to increase the likelihood that they'll return to prison. Substance relapse, lack of treatment for mental health conditions, history of untreated drug abuse and mental health. I gave you the stats and kind of talked to you a little bit about what they are. So substance use relapse is the number one reason why people violate probation, right? Meaning they pop positive for a test or whatever it may have been. That is the number one reason why people violate probation. So depending on how many violations or how many hots that you've had, guess what? You may be returning to prison. So it's very difficult when I'm trying to feed my family, find a job, meet court requirements. I'm being policed and I'm being policed to death. It's really difficult to take care of my substance use issues because I have so much other stuff to worry about. So look at the stress. You got to meet probation. You got to go to court. You got to pay all this money. If I have a job and I just came home from jail, and I have to meet my PO every 2 days at 10 o'clock, but I have a job to be at, the likelihood that employer is going to continue to employ me is going to be low. So the supervision guidelines that we currently have for people that are returning to their communities and trying to be successful is simply poor, in my opinion. We are not supporting them the way they need to be supported because the requirements, the demands are really outweighing them, and they really can't handle those types of things, which is why that first year you saw that most people return to prison, because it's almost like it's easier to be in jail than try to live my life because you guys won't let me do it successfully and give me a true second chance. Also, look at the lack of access to consistent support after release. So if you have a felony record, guess what? You can't associate with anybody with a felony record. So if you can't get housing and you want to go back and live at a relative's house, but somebody in that relative's house has a felony, you can't go there, right? So it just continues to perpetuate the lack of access. Remember, 400,000 civic limitations. It continues to perpetuate the inability that people can really be successful after they return home. All right. So some of the theories that I feel this plays a lot into is, let's talk about a little bit about social norms theory, right? So social norms theory, it aims to understand the environment and how the environment is impacting somebody's ability to be successful. Okay, so how does our probation, our parole, and our supervision systems impacting the success of people who are returning from prison and really trying to change their lives? Right now, we don't have effective systems in place, right? So instead of focusing on the person, this is your fault, you went to jail, you did this, social norms theory wants us to say, hey, let's look at the environment and what's going on around it and see how we can support these individuals, right? But what we know is when it comes to Black men or Black people in the social justice system, this is not the case, because a lot of times we are not supported in this area like we need to be. Also, labeling theory. This is a part of mental health. If someone continues to tell me that I'm a criminal, I'm a felon, I ain't never going to be about nothing, the labels that society puts on individuals returning from prison, primarily Black males, eventually what happens is they begin to believe that. They quit. Well, I'm not going to try to be and do what I'm supposed to do. I'm not going to try to be great, because guess what? If I do that, no one's going to give me a chance anyway. So what happens is those stigmatized attitudes are internalized, and people kind of withdraw from conventional society and they go right back to the behaviors that they've been having before, right? And that is very significant. If I can't get ahead because nobody won't give me that true second chance, then you know what? Why even try? All right, so here's a question I have here, and I think I might can get in this chat box here. All right, I think I see the Q&A section here. But where's the little chat thingy? I want to ask you guys something. I want to talk a little bit about, and it was so great that Dr. Joy brought up the implicit bias component, because implicit biases play a big role in how Black people and social justice is delivered for Black people. So I want to just ask a question here from for you guys here. If you don't mind helping me understand, how does implicit biases impact how social justice is delivered for Black Americans, in your opinion? How do you feel about that? Can we have that? Where's that chat box at?
So if you're sharing your screen, yeah, there should be a bar.
I see it. All right. Labeling period is troubling. Yes, Lily, I agree with that. So when we think about implicit bias, guys, I want y'all to think about that thing that's not as conscious, right? So when we think about explicit bias, think about when you, when somebody say, if you see a Black man in the elevator, get out of the elevator, right? You already know that's prejudice, but what happens is the reaction to that Black man it makes it become implicit. So assumption of guilt, microaggressions, yes, to internalize oppression and its impact on our community. Preconceived notions about Black men, yes, that is a big one. That's a really big one. That's that explicit bias feeding our implicit bias. And when we talk about that, do you guys know that 85% of all Americans consider themselves to be unprejudiced? Yet, research has concluded that the majority of the people in the United States hold some type of implicit racial bias. But during the survey, 85% of people said they're not prejudiced. What do you guys think about that? Now, we all have implicit bias. That's just something that's natural. Every single person in this forum has implicit bias. But because we don't know or believe we have implicit bias, 85% of people said they're not prejudiced. What do you think about that? Yes, Cheryl, and this happens to white and Black people all the time. I disagree. Tell me more about what you disagree with, Shaquetta. All right, I want to move here so we can keep it moving. All right, so let's look at some common impacts to mental health reintegration, stigma associated with getting help. Why do Black people, particularly Black males, not want to seek mental health care or medical care? There's a stigma associated with that, right? I feel as a community, we have gotten so much better with seeking care, but there is a stigma, you know, for Black women. We talk about the superwoman syndrome, right? I got to make it happen. I got to get it done. I don't have time to take care of myself. I got to take care of everybody else, right? So there's a stigma that is associated with that. Ineffective family reintegration, right? We do not have good reintegration systems to help families reintegrate properly once their loved one comes home from prison at all. We do not. So you've had your loved one gone for, say, 5 to 10 years, which is a common drug charge sentencing. And now they're coming home. You have kids who are 5, 10 years older. You have a spouse that's been doing things the way that he or she has been doing it, but we don't have anything to help them reintegrate. We don't have anything in the prison system to help them reintegrate. Distrust in the medical care system. Let's talk about that, right? It is very difficult, right, to trust the medical care system. Look at what Dr. Joy talked about today, right? It is when Black people walk into let's just go with a regular medical doctor. When you walk in there, the fear that someone won't believe that what you say is wrong with you is wrong with you is an actual thing, right? As a mental health therapist, it is 4% of me as a mental health therapist. I posted some of that energy on my Instagram today. 4% mental health licensed therapist, right? So it is very difficult when you walk into a room and someone doesn't look like you to sit and talk to them about your personal problems. The lack of diversity in provider care. Let's talk about cultural responsibility, right? Responsiveness, I'm sorry. So you can understand me as a Black person, but are you culturally responsive to my needs? A lot of medical providers are not able to be culturally responsive, which is another thing that turns Black people off from medical care. Civic limitations, we talked a little bit about that. Voting, license, IDs, background checks, felon interaction, housing, finances, we talked about that as well. Any additional impacts that you guys may know personally through your research or through your work that's impacting the mental health of Black folks that are returning and integrating into their families. All of this in itself is stressful. Think about the stressful things that people go to when they're trying to come home anyway, and then they got to navigate a system that's not even meant for them to be successful. Anybody? Throw some additional impacts out there in that chat if you have them. All right. Many see the criminal justice system as the enemy. Oh, Barry Waters, I want to hear more about what do you mean when you say that? How else should they see the criminal justice system? A lot of individuals aren't familiar with how to navigate the system, have limited resources, including transportation to appointments. Exactly, Teresa, because the system is really not made a lot of times to help individuals be successful too. All right, so I'm gonna move into some rehabilitation versus incarceration. So we're talking about this in the chat now. Once you're in the system, it becomes a revolving door, right? People could have gone in the system for one drug violation, and it takes 5 to 10 years to get out of that system, right? When I did research on expungement opportunities in the United States, 4 states have expungement opportunities with the least amount of time being 5 years before they can actually be expunged. Not sealed, but expunged, meaning it cannot be seen unless it's a federal agency. If the first year of recidivism if returning to prison for drug offenses is highest in this first year, waiting 5 years for an expungement opportunity is not happening, and it's not the business. And believe it or not, North Carolina is the longest with 15 years. Lack of rehabilitation efforts in prisons is more about control of bodies versus helping people in the prisons. Lack of experience treating mental health versus the time to treat. A lot of times your COs may not have the mental health experience or training to work with people who may have mental health issues. So the biggest thing is we restrain, we medicate, we put them in solitary confinement, right? Mental health professionals are being paid so high to work in prisons because there's not a lot of time to treat people in prisons. Remember what I talked about, you're treating the more severe cases. You need to control those bodies. So it's hard to deal with the person with anxiety or depression. That's small talk compared to someone with psychosis or schizophrenia. Increased trauma that exacerbates present trauma. Prison is exacerbating present trauma. I believe that with my whole heart. Regardless of what anyone says, when people are going to prison, there's a certain image people in prison have to have. You're not dealing with your trauma, you're holding in your trauma. So regardless of however we try to flip this pancake, being in prison is exacerbating the trauma that you likely already have. Lack of some family support, right? You all the way in California, but your family live in New York, so you don't have that family support. Reintegration plans are non-existent. You're going back to the same place with the same issues that actually got you there. Increasing poverty due to economic exclusion, right? You're already excluded. And criminal record decreases employment opportunities by 50%. So you are already walking out of prison with this felony drug charge one time, and your likelihood that you're going to go and get a good, decent job to support your family is already cutting half by 50%, right? Mental health conditions is already worsened when you go because you're not getting what you need. What I feel rehabilitation does, it helps with consistency in treatment. Forced rehabilitation increases higher rates of appointment attendance. Now, I know forced rehabilitation is not always what we want, right? But if you have the alternative, I'm sending you back to jail or I'm sending you to rehab and you need to complete your 6 months to a year, the likelihood that you're gonna gain something from that rehabilitation at rehab is gonna be higher than going back to jail. Safer detox for substance users and those who experience trauma, you're able to actually safely deal with those things. No criminal record. Increases employment opportunities, right? Instead of dropping a felony on you for a first-time drug offender, let me go ahead and put you through some other type of rehabilitative process so that you can continue to be successful when you're done with that. Individualized treatment. When you're in rehab, depending on how the system is set up, I know all of them are not great, but it's better than being in jail. You can have individualized treatment. If you have somebody with PTSD, somebody with depression, anxiety, sexual assault issues, you can have an individualized treatment plan with your psychiatrist, your social worker, or your counselor while you're in prison. Rehabilitation provides a true second chance in society. Because if you are sending someone to rehabilitation, you are giving them the opportunity, not saying it's always going to be successful, the opportunity to change their lives. It also involves their family. What we know about mental health and substance use is it is a family issue, and it impacts the family so much that families need to be a part of that process. Obviously, for me, rehabilitation decreases recidivism rates and builds and sustain marginalized communities. I want to see Black communities be sustained. I want to see Black businesses. I want to see our communities thriving. I don't want to see police officers in our communities every 5 minutes policing. I want to see people supporting our communities. And when we look at rehabilitating a culture with so much transgenerational trauma, we can support sustaining and rebuilding those communities. All right, recommendations. I'm going to wrap it up. So here's just some crystal recommendations, right? Rehabilitation is also about perception and the normalization of behaviors. Why would I say that, right? We are not normalizing that people are struggling with mental health and substance use issues. It needs to be normalized more. Decrease in negative social norms surrounding Black people and communities, that needs to happen. Okay, talking about why Black people are experiencing what they're experiencing right now, talking about why Black men run versus move toward the police, right? How can we normalize these perceptions that we have as Black people when we're interacting with our social justice system? Research and studies on Black mental health. It is not a lot of stuff out there on Black mental health. How in the world are we going to know what we're treating and how we're treating? How in the world are we going to know what to treat and how to do it if we don't know what we're treating? We need more research and studies on Black mental health. The data is very low. As you can see, my study data was from 2014. The data is low. Be honest. right? Implicit biases are a factor in the interaction of Black people in the criminal justice system. Many of the new things that our federal government are really just band-aids for really long-term impacts of incarceration. Ban the box is okay, but guess what? Ban the box simply says that you don't have to check that you have a criminal background history when you fill out my application. But if I decide to hire you as an employer, guess what? I get to run a criminal background check and I get to decide if I want to still hire you. So while that's okay, is it really effective if I still have the ability to run that criminal background check, right? Overhaul police and correctional training programs for employees. Yes, I'm going to say it. We need more accountability in our correctional training programs and our policing programs, and we need rigid screening process, focusing on mental health. A lot of times, people in these positions are maybe in them for a reason. Why aren't we doing more thorough, concrete mental health evaluations on people who are wearing uniforms that are supposed to serve and protect the world and the people around them? Why is the academy less than what all other countries are doing right now? Why aren't we doing thorough mental health examinations on people that are in these positions? I don't understand why, and I think we have to focus on the mental health of our policing and correctional training programs to make sure that people are fit for these jobs. Divert money to break up the school to prison pipeline, period. We're talking about defunding the police. I'm not the whole big defund the police person, but what are we gonna do once we defund them? How do we break up these school to prison pipelines in our communities? How do we support these families who may be struggling with that one parent being in jail and they're acting out in school? Stop privatizing prisons in the US. Stop it. Privatizing prisons in the US is a moneymaker. The rules in these settings are too fluid. There are not going to be certain requirements that may be in a state, a local, or a federal prison, like focusing on rehabilitation so people can be successful when they get out. We need to stop privatizing prisons. Increase treatment facilities at local levels, meaning if I have an individual who I'm sending to rehab, why don't we have more rehabilitation and chemical dependency and mental health institutions in local cities to help people and their families deal with some of these issues? Expunging first-time drug offense records. I'm a proponent of that. That was a part of my research. 46% is what our system is made up right now of drug offenses. So if we work on expunging at least first-time drug offense records, I wonder how much that number would definitely decrease. Any thoughts or any other recommendations from the chat here on what you guys would like to see? Officers should have to pass an annual mental health exam to verify that they're fit for duty. Focus on mental health evals. I'm a proponent of that. The police are scary to me. When I see them, I want to run. Why? Because you have been taught that that's what you should do. You have been socialized to fear the police. And that's exactly why. Assisting with reuniting families after release. That is really big because a lot of times families really struggle with that, especially in our communities. Wow. Yes. All right, so I see some Q&A questions over here. I want to make sure I get over here as well. Does the lack of standard definition for recidivism create policy challenges? Thinking of how the lack of a standard definition for trauma creates varied approaches to research and treatment, and one of them is the same. So Lauren, I feel personally we have to decide what recidivism rates are before we can actually do research in that area, right? So do you know that certain local prisons or state prisons will send someone back to jail for rehabilitation and send them to drug treatment in jail? So do we consider sending someone to drug treatment recidivism if we're sending them to rehabilitation, or are we looking at whether someone commits a new crime? I think we need to sort that out, Lauren, in order for us to really determine what true recidivism rates are. Will these slides be available at the presentation? Yes, I think the slides are being sent out. I'm definitely giving permission for mine to be sent out.
Yes, they should be.
Okay. Any research on race disparities on utilization of solitary confinement? I don't have any on that, Sean, as well. But remember, we barely have we barely have data on Black Americans in the incarceration system, but I don't have any personal data on solitary confinement at all. So no, I can't answer that one. How can we create positive change that feels attainable? I agree. For me, it is very overwhelming. And for a person that does a little bit of both, just like that was introduced to me again, I'm also active duty Air Force. So my days, right, are filled with Air Force stuff, and my evenings and other things I'm doing in the community is filled with this. So I think it can be very difficult. Unfortunately, with so many states, so many different requirements, a lot of times what can happen depends on who's in office. It depends on who's in your local office and what they want to make the priorities. You have to have people in your local legislative offices that are willing to make these type of things a priority. And guess what? A lot of times when it comes to money, if people are not seeing quick results in studies, they're going to take money away from you. A lot of times when you're giving someone, say, $1 million for a study, like for example, my program, I asked for $1 million for this to implement the program I wanted to for first-time drug offenders. So what would happen is, to really see any impact, this program would have to at least go for 3 to 5 years. People don't want to wait 3 to 5 years to see what their $1 million did. They want results now. So I feel, to answer that question, attainability, we need patience. We need people to have patience and want to put in the work to do that. Do you feel that there should be a different approach with the juvenile justice system as it pertains to rehabilitation? No, I do not. So I volunteer here at the local DJJ, and they struggle with a lot of the same things. Now, remember, their records, once they're done serving their time as juveniles, those records don't follow them as adults. But I think a lot of times breaking up that school to prison pipeline, that's where I see my girls get stuck, in that school to prison pipeline. So as far as treatment, yes, I have teenage girls who are addicted to drugs, meth, pills, all of that, right? So I think the rehabilitation component needs to be very similar. How do we help Black communities to make them feel more comfortable coming to seek mental health services or to have adherence to treatment? Monica, there needs to be more me in Black communities, right? There needs to be more availability in Black communities of people that look alike. We have to work to normalize mental health and substance use and help in our communities. And I think that is so hard. And I'm gonna say something that may tap in to some of you guys and make y'all mad, but the church, right? We all have our religious beliefs, and I respect that. But when we talk about how the church plays a role in mental health and substance use, sometimes that can be a conflict. And I think that we have to realize in our community that the church and mental health should not be doing this, but we should be doing this. And so I think for our more traditional communities, we need to tap into some of that as well. We need to reform the way prosecutors and judges respond, and they be educated on an ongoing basis. Lisa, yeah, I agree. Unfortunately, our prosecutors and judges have so much, district attorneys, they have so much control, and they have to be willing to. If your district attorney's priorities is decreasing recidivism rates, then you might make some movement. If they're not, you may not. I live in a state right now where policing is a priority, right? I live in a very conservative space. A positive drug test in my state can get you a felony charge. So the police pull me over, give me a urine test, it's positive, I can get a felony. That's how conservative this state is. So you have to have people that are willing to work through that. Wow, y'all got some good questions. How much time do I have? Whew, wow.
You have 13 minutes, so go ahead and answer as many as you'd like.
Do you feel that mandated programs such as pre-release and supportive housing programs that help to actually rehabilitate and help individuals transition will lower? Miss Mickey, I think that's, I'm gonna say Miss Mickey because I don't want to mess up the name. I think it has to start in prison. I think as soon as you walk through the prison door, rehabilitation needs to start from the beginning. I don't always think that waiting to get out to start these transition programs are effective. You got to get the memory, and you got to become socialized with getting better and rehabilitating as soon as you walk in the door. And that's what I think. So I don't think just waiting to someone gets out is what we should be doing. I think we got to start that up front. Now, do I believe that those pre-release programs and halfway houses and things are effective? Absolutely. But folks have to be able to want to put in the work with anything. Just keep in mind, though I have these recommendations for systematic change to support us, the individual has to want to put in the work as well. But I believe that as soon as somebody walks through the prison doors, that's when rehabilitation needs to start. Oh, Barry, I agree with the recidivism. What is my contact information? I'm gonna put it all down here for you guys that wanna reach out. I'm a very active social media girl too. So if you wanna reach out in the DMs, you're welcome to do that too. What state do you live in? So I'm currently stationed in Rapid City, South Dakota. Yes, I said Rapid City, South Dakota. So can you imagine? I'm waiting for the chat to just blow up right now when I said that. Mary, the research on trauma caused by just being in jail. Mary, I don't know that there's a lot of research on trauma about being in jail because we're not even taking care of the people's mental health that's currently in prison. So I don't have any knowledge in that area at all. Brian, you love this place to visit. It's beautiful, but 6 to 8 months of winter and blizzards and ice is not nice. Brooke, I currently work with returning citizens and I really struggle working with community supervision officers. Yes, because I do not feel that the system is created to actually help these individuals. I agree, Brooke, and a part of my initiative here is getting the supervision officers on board, because in order for the programs to be successful for rehabilitation, you have to have them on board. And I do agree with you. A lot of times it's very difficult because remember, they are also operating in a systemic place as well. Just like your probation just like your correctional officers, they are thinking systemically. So it can be hard to get them to deviate from that as well. Teresa, for the school to prison pipeline, does research only focus on individuals tried as adults or does it include juvenile detention? So I'm not sure as far as, I think, so the school to prison pipeline is really, really one of those things that's up and popping, right? And because it impacts primarily us, I think it's one of those things where we're gonna see maybe some good data in a couple of years, but I know that there are things out there. I just don't have a whole lot of knowledge on if they're only focusing on adults or children. So I don't have a whole lot of knowledge. If you wanna talk more details, just hit me up and we can do that. Cassandra, hit me up on email. I have a lot of book recommendations. I do. All right. Anything else? Where is that, Barry? Rapid City? I'm in the North Midwest, the North Midwest of the US. Think about Mount Rushmore. Mount Rushmore is about 20 minutes from my house. Not a lot of data on recidivism. The data that if you go to the Bureau of Justice System, you will find all real-time data, but it's not a whole lot on recidivism in that area. All right. Rosin, I thought I put it in there. Is there any other questions? I'm done. If there's not, if you have any personal questions, just hit me up on email and I'll be happy. What are your thoughts about the inability of society to forgive offenders and instead limit their ability to move forward from their charges? When you say offenders, do you mean Danica Harper? Do you mean anybody, or do you mean certain type of offenders? I think social norming impacts our ability to forgive, right? I think we tend to think as a society that if someone has been to prison, then they are a bad person, right? And so I think social norming really will impact our ability to look more at forgiveness or rehabilitation versus labeling people. For school undergrad, I went to Winthrop University in Rock Hill, South Carolina, the University of South Carolina, because I'm from South Carolina, and then the University of Southern California for my doctorate. Yeah, I think I answered your question okay.
All right, I
All
think
right.
we can wrap things up now so that people have enough time to transition over to the closing remarks. Thank you so much, Dr.
Thank you guys
McLeod.
so
This was
much.
really wonderful, and I know that everybody enjoyed the presentation. I don't know if everybody got to see that, but Dr. McLeod did drop her email in the chat. I also posted it in there once or twice, so hopefully everyone has received it that wants it. But if you want contact information for any of the presenters, you can also reach out to us at mdh.suicideprevention@maryland.gov, and we will connect you with any of the presenters that you're interested in speaking with. This is just a reminder as well, those closing remarks are coming up after this at 4:30. You will want to stay for those because we will be talking about the CEU certification process after some remarks from the executive director of BMHA. And I just want to say one more time, thank you so much, Dr. McLeod. That was a wonderful presentation, and you answered so many questions.
I know. I was worried. I was like, for people who don't want to ask questions.
No, you got, yeah.
15 minutes for questions, but please hit me up if anybody else. After the conference, I'll just be grading papers on social justice. So if you guys want to hit me
go
up,
figure.
I know, right? If you guys want to hit me up, then I'll be here at my desk grading papers, so I'll be able to do that.
Wonderful. Thank you so much. I'm going to end the session and join us for closing remarks, everyone. See you there. Bye.